Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. I'm your host, Kemi Gbadamosi, and together we'll explore how storytelling, innovative campaigns, and disruptive strategies are shaking up global public health. We'll talk to experts, policymakers, and grassroots mobilizers who are pushing boundaries and rewriting the playbook on public health advocacy. So, if you're ready for fresh ideas, game-changing conversations, and a bit of fun along the way, you are in the right place. Let's dive in. They've been the backbone of global health, connecting systems to communities, responding in crisis, educating the public, and holding governments accountable. From HIV and Ebola to Mpox and COVID-19, civil society organizations have always shown up. Yet, too often, they are brought into the room but shut out of real decision-making. Why are those closest to the ground still treated as sidekicks rather than power players in global health? Today, we're asking a long overdue question. How do we move civil society from tokenism to true influence, from being at the table to truly shaping what the table looks like? Welcome to the Global Public Health Revolution podcast, where global public health meets bold advocacy and game-changing marketing. I'm your host, Kemi Gbadamosi. To help me unpack today's episode, I'm joined by two incredible voices. Aggrey Aluso of the Resilience Action Network Africa and the Pandemic Action Network, and Elisha Dunn-Georgiou of the Global Health Council. And today we're talking a really important topic, especially even for the times that we're in, globally, when we talk about the state of global health, for example. So if we could start with you, Elisha, if you tell us about yourself.
Sure. And thanks again for having me. It's great to have this important discussion. I've been working in global health for a while now. And for me, it's really seeing health as a key factor in equity. I came into the field having seen quite a few disparities in health and got very interested, particularly in the health of women and girls and marginalized communities, and have stayed in it since, recognizing that it's more than just a technical issue, that, who has access, what quality of access you have is a political decision, and it's policies and power that really help to shape people's health and well-being.
I hear the underlying tone of equity as one of the key factors that inspired you on this journey. So let's go to Aggrey. What's your own story?
Thank you, Kemi. And not far from Elisha's story, I think my journey in public health and global public health started from my own personal experience. Growing up in Western Kenya region in a period when HIV was ravaging the area, the region, more than anywhere else in the country. And very stark patterns, really unfortunate patterns of the face of the disease being poor people already facing certain marginalization, women, young girls, people who have economic challenges. It quickly dawned on me that it's not just about the virus. This is a challenge that is being created by the structural and systemic challenges that are in our community. It hit home very, very close to me, losing a number of close relatives and struggling to turn the tide. And I realized that this needs to be done at a political level. And that's when I threw myself in after finishing my undergrad. I decided that I must lend my little effort in trying to turn the tide, address the structural barriers, including the cultural dictate, the policy inequities, and many other challenges around it. So that's how I have been. It's been a journey from the grassroots to the national, to the regional, to the global stage. Issues are mostly the same, different diseases, same issues. And I think our struggle is far from being complete because these structural challenges still persist to date and even getting worse.
Thank you, Aggrey. So in listening to you and Elisha, I think it's that passion, that wanting to right what's wrong, that has led you on the journey, and in terms of accessibility as well. And that's, I think, one of the powers that civil society organizations hold. is being able to ensure that we can make sure that there's access, there's equity, that those who are marginalized are brought to the center and no one is left behind. Pretty impressive experience and journey from the two of you. And thank you for sharing that with us. So on to this topic, we put the spotlight on civil society organizations. People call them the watchdogs a lot of times, but there's so much more to civil society than just accountability or holding people to account. Something that has over the years declined is the voices of civil society in decision-making spaces, in the places of power. It's also the presence of civil society in these arenas as well, despite how critical they are to global health. So, for example, we look at the pandemic agreement, which is a laudable instrument that helps to reshape how the world does and responds to pandemic, making sure that what happened during COVID-19 never has to happen again. But yet we see that civil society really wasn't part of the negotiation. There were conversations on the sidelines, granted, but in the space where they should have been, given that they are so close to the communities, given that they are very close to the lived realities, we didn't have them in that space. I think also of the Pact for the Future, which came out of the Summit of the Future. Again, civil society had to fight, to push, to get their own voices to contribute to the Pact for the Future. And it makes us wonder, why is it that those who are very close to the communities and representatives of the communities themselves, why have they often shut out? And there's the growing fear now that the space continues to shrink and shrink, even for civil society. So that brings me to the first question. And this one, I'm going to give it to you, Aggrey. And that is, what do you think has kept civil society in a largely tokenistic role in national and global health governance, despite their proximity to the communities?
Thank you. Thank you, Kemi. Very important question indeed, because that's what has kept some of us awake for quite some time in a lot of spaces, critical spaces, the ones you've mentioned. I had a personal direct experience with the pandemic agreement, the INB process, trying to make a case for civil society to be included in the negotiation as people who are very close to the reality and who have first-hand knowledge of the equity challenges that the process was actually saying they want to address. Yet we pleaded and only got tokenistic provisions of, we'll brief you at the end of every day and you don't inform the sessions. So it's not just in this particular space. It's a very unfortunate historical challenge that my analysis trying to really understand how we ended up where we've ended takes me back to the colonial legacy of how health has always been framed in our context, particularly in the low and middle income countries, where health was brought to us as issue to pacify the subjects so that they can see that the colonial enterprise was working it for them. But then it was the one thing that was used more deliberately, delivered through charitable church-based processes. And that unfortunately robbed it of the political imperative. And people started associating health with charity and, discretional right that if you're lucky, you blame your misfortunes. And that has created challenge that has persisted even with progressive levels of evolutions in the health systems. We've seen health continuously also still being supported through philanthropies, through donations, right. And that continues to rob it of the local accountability. And whereas people organized more around civic and political rights, socioeconomic rights largely, and particularly those around human capital, have remained largely not very well organized around. So I think that has really continued into a number of our spaces and has depoliticized and created lack of commitment. And you have now what we've ended up with, organizing that have followed the financing trends. So you have disease-focused organizing. So folks working on HIV, folks working on TB, folks working on malaria, and that does not lend itself to the political capital that if we had a cross-cutting collaborative network of our groups advocating for health equity, would have had. And that's what we've been trying to do at Resilience Action Network Africa, to really close ranks. And COVID really was a turning point that should have really been the moment where we all now pivot differently. But we're seeing that we're still struggling to sell that agenda. But I think it's a struggle we'll not give up on. And that has been perpetuated into the global spaces where we've seen organizing still following very narrow, linear trends that do not bring the political weight that would help us now get into the spaces for decision making.
Thank you, Aggrey, for pulling out really key points to the issue of the colonial legacy of how health has been done historically. That was also something we talked about in the first episode. And I think it's something that we have to look at critically, even if we talk about strengthening civil society voice and influence, is the need to decolonize global health, moving it away from charity. That's a call that is growing, moving it away from charity, looking at it more as an investment, looking also at the opportunities that exist for us to be able to shift the power dynamics that oftentimes controls how health is done. How can we ensure that civil society goes from just being at the table to observe to actually shaping what the table looks like as strategic partners and policy shapers themselves?
Thanks, Kemi. I think that's the billion-dollar question. I'm not sure I have a complete answer. I do think, just to pick up, though, on what Aggrey was saying about colonial, the way development and global health functions in a colonial model, I think one of the ongoing struggles, recognizing that, as we said, both of us in the beginning, that it's a political issue, who gets health access, and is when you have that model and you're a civil society actor that wants to make change, it's very difficult to understand who really holds the power, right? I mean, and I think that goes to the conversation around this sort of all of these things that happen at the global level, all of these agreements and documents and commitments that are made. All of those have to be, one, financed, but they also have to be operationalized at the national and subnational levels. And so I think in the colonial environment, we see pressure from high-income countries and from donors, philanthropic and private, of wanting national level civil society to engage at the global level. But that doesn't necessarily serve people in the long run, because you then lose the operationalizing in your own environment. And we have limited capacity. I mean, I think this idea of getting a seat at the table is important. But the question is, are those equitable seats at the table? We get asked to do so many things for free as civil society. There's no other sector that I can think of that is asked to expend so much intellectual capital, physical labor, emotional labor, diplomatic labor without reimbursement. But civil society always, because we care, we have passion, we want to see things better. If we are asked, we will do it. And then we will think about funding second, and everybody else thinks about funding us second too. There's definitely getting a seat at the table, but asking some additional questions of, is it an equitable table? Who's served by this table? What does it take to influence and shape an agenda at that table? And those questions need to be asked alongside this goal of getting at the table, because it puts you in a very unfair position if it's not an equitable seat. And there's also such a diversity of civil society that there's different skills among civil society organizations. Some are very community-based, others operate at a kind of national and global advocacy level, like PAN and Global Health Council. That it takes different skills to sit at the table. And it's another kind of burden for civil society to really build our own capacity on and be fluent in the language of power and how that works at these tables. And so you have to understand financing and how decisions are made and what the diplomatic levers are to pull. It's quite a big job to get at the table. And then once you're there, really being able to leverage that is an even bigger task.
When you ask the question, is it an equitable table? I think that's important. And that's something that civil society organizations should look out for when you are invited into a space What is the ratio? So I think it's important that even as we look at strengthening civil society, it's also making sure that we're building the right capacities at every level, making sure that they're empowered and equipped enough to come into the space. But it's also for civil society to remember to ask, how equitable is this table that we are in? So it takes me to the discussion on shifting powers a bit, colonial legacy. Oftentimes, it is the donors who set the priorities, and they often do this from afar. Donors set the priorities, living far away from the realities or the needs on the ground. Is there a world where we can flip that dynamic? For example, with everything happening now, and we're shifting more to more regional approaches, national approaches, more discussions around reliance, sustainability, resilience at the national level and the regional level. Is this an opportunity for us to flip the dynamic where civil society can get to the point where they say to funders, if these are your outcomes, then these are the needs that needs to be funded? Is it possible to achieve this? And if yes, how do we go about that, Elisha?
You're really asking me the hard questions, Kemi.
Don't worry, Aggrey will chime in on this one too.
I think we and donors use that term to mean strengthening civil society to operate at the national level or the global level. And that's what we think of as strengthening. I think that part of the problem is we only think of that as upward, right? Like getting out of the community to the national and global level means that you've sort of arrived as a civil society organization. And if we would really, and donors would recognize the incredible skills it takes to operate at the community level, delivering services, caring for families, communities, neighborhoods, I would just say I could not do that. Like that is not in my skill set. And so if someone needed to build my capacity, it would be how to work effectively at the community level. Like I operate in this kind of macro policy space. And if I had to suddenly start operating a community-based civil society organization, I wouldn't know how to do it well. And I say that because it's really important to recognize that the diversity of civil society is a strength, not a weakness.
Yeah.
And unfortunately, donors don't include that except as sort of another rhetorical statement as they're sort of praising how close civil society is to like people. I mean, civil society is made up of people. So it goes back to this colonialist tendency of like top down, global is more important than local idea. But the reality is much more complex than that. And if we continue to do this preferential treatment of like global action, we really lose the context at the national, subnational, local level and what kind of civil society organizations are needed to make people healthier, right? It's a big swath. Definitely those CSOs that are kind of at the front line have incredible wealth of information and stories and experience that can be used to advocate and change policies and shift power. But there needs to be more partnership, I think, within the civil society community of those who are kind of skilled in that advocacy lens or communications lens, shifting power, to work with organizations who are at the front line so that we can say to donors, like, we know what works, we've lived it, we need you to recognize that you have to respond with humility, right? I think that's getting the donors to respond with humility is the linchpin.
I know, it seems like a tall order.
It's a tall order. It is a tall order. And I mean, I think what we're doing of just like constantly hammering away at that, you know, like we know what we're doing. We have the lived experience. Listen to us, listen to us, listen to us. Like it's a slow process, unfortunately. And also understanding like who is the donor beholden to, right? I think that's the other question. So if it's a bilateral donor, as a country going through incredible political turmoil right now, the bilateral donor is supposedly beholden to the people that elect that donor. And that's sort of where their response is coming from. So if it's a philanthropy, is it that the program officer is beholden to the head of the philanthropy? Like, you have to also sort of figure that piece out so that you know who to talk to and how to message it in a way that resonates. I mean, it's all, speaking as an advocate, it's all advocacy, you know, of like figuring out your audience, figuring out what the message is that resonates them. But also, you know, civil society has some work to do of not gatekeeping our own community. So I'll stop there. I'm sure Aggrey has a lot of stuff to add to this question.
Thank you, Elisha. I agree. Any thoughts? Can we flip this?
Yeah, and thank you, Elisha, for bringing that perspective. I think I start from the point you mentioned earlier that civil society are not homogeneous. And I think the table where we get to sit in after a lot of struggle, as you know, ably used the example of your presentation at the Pandemic Fund, I think is a real example of how sometimes you're set up and you have so much responsibility, but you don't have the tools to deliver it with, because the assumption that you have the means to organize and develop position from the constituency, the vast constituency from Global North, without any support from elsewhere, I think is just not tenable. And we struggle to do what we can. But I think a real move towards meaningful engagement of the civil society would, for example, look at the numbers, but also would look at how people are facilitated to be able to actually be accountable to the constituencies. Sometimes we are set up and we end up not being accountable. So yeah, the shifting power question is one of the most important things, Kemi and Elisha. I think it's what we have been trying to unpack, a number of us who have been struggling to create a shift from status quo to a more equitable and meaningful engagement and the delivery of health as a democratic rights outcome. Because I think what we have seen in typical context in many African, and I want to believe in other LMIC context, where we have our health being supported, I think the fact that the bulk of health is actually supported by the people themselves from out of pocket health expenditure, and a significant amount is also supported by donors. And that just creates another set of challenges because not everybody has the capacity to pay the out of pocket. And if you don't have access to those health services that are probably supported through other charitable means, you may not have a choice. But then what we have seen with a lot of the donor recipient arrangement is the gap filling tendencies and cherry picking what to support in ways that do not lend itself to shifting powers or supporting pursuit of health as a democratic right in a sustainable way. Because what we've seen, and there's a study article we did a while back, too much resources coming into the health, particularly in the LMIC. We did it in the Alliance magazine, and without so much to show, because every time a project ends, people are back to square one. Because the way the support is structured is not aimed at creating a sustainable system that would be able to deliver health. It is mostly created in ways to deliver healthcare in a particular sector. So it's not outcome focused, not delivering health as an outcome, it's delivering healthcare for a particular area that they have chosen. And that also creates an accountability lacuna in terms of people who have responsibility to deliver this being conditioned to always just expect. What you need to project is the deficit. And then you make a case why somebody needs to support it. And that is what has created a lot of unsustainable health system within the African context, which, if I can speak for Africa. And this is something that needs to be challenged intentionally, because the way systems are now planned, because we want to position or we want to structure our health systems in ways that appeal to those who are supporting us, it's not lending itself to supporting systems. So if donor is not going to support you in driving the health system transformation to be one that is nimble enough to be able to prevent diseases, primary healthcare driven, you find that government are not prioritizing. So they will talk about UHC, but our UHC is curative. It's looking at healthcare delivery, not delivering prevention or not supporting health promotion. And also what it has done, it creates that lack of engagement from the civil society organization, because this is not our money. It's money that comes from outside. We are not now organized to challenge the accountability gaps that we are seeing. So what we've been telling people, like, donors should mind the gap, but don't rush to fill them. I think what needs to happen is we need to understand why the gap exists and how can it be filled, how can it be addressed sustainably. And the sustainable way of addressing gap is by capacitating the local government to be able to deliver health to their people. Where the genuine emergency needs that needs to be addressed, that can be handled as a stopgap measure, but not in perpetuity, like what we have seen. And then the bulk of the investment should go to the people being able to drive their governments to deliver health for them, being able to define what they need, being able to hold their governments accountable, and governments having the capacity, building their capacity incrementally to be able to do that. For me, that would be what donors would do. So their role should be catalytic, not an end in itself. And it should be not gap filling. It should be system developing.
Yes, thank you, Aggrey. So system development, being aware of the gap and not rushing to fill it. And even for us to be able to achieve that level of making sure that health is delivered to the people. So I'm still going to stay on you because now we want to go to civil society and how they can sell their values. I use the word sell here very loosely, but basically, what are some insights from your own experience, Aggrey, that you think civil society can use to sell their value to governments and build trust?
Thank you, Kemi, for that question. You've heard about the Gen Z organizing in Kenya. So when they're asking for something right and they were saying they're faceless, they tried looking for who the leader is, they didn't get. Then they started now creating narrative. Oh, there must be some donor that we don't know. They even tried chasing someone. So in many instances, civil society organizations mean well. In many instances, when there are no all this intervention, and I remember what I was telling colleagues who I've worked with in the philanthropy sector, let us not monetize organizing. We can catalyze, we can incentivize, but let organizing happen spontaneously. And a lot of times it happens well. But we have forces that are determined to create counter narratives that therefore the other negative narrative sell more than the actual narrative. That's where now we have to really work also as civil society organization to make our side of the story hard so that the government, the other actors who probably may not appreciate how we are pushing things, don't carry the day. Yeah, so that needs to be done. And I think those who support sometimes, most of the time, nearly 99% time, mean well. Sometimes you create a narrative when you jump into an organic organization and you come in with support, which is well meant, but then you now externalize the struggle. It is labeled as something that is externally supported, not internally driven.
Very loud and clear there, the issue of monetization. I think that's important, and just organization as well. We do have a fun question segment, which I'll take you through very quickly. But before that, suppose we truly transition from tokenism to power. I sincerely hope that we can do that. I believe we can. And I think we have a really good opportunity now in the world to do that. What would civil society leadership, voice, and influence in global health look like? For example, in agenda setting, in financing decisions, and of course, accountability. Let's start with you, Elisha.
Thanks, Kemi. I do want to say that sometimes causing a problem is what you need to do. So
Well, let it call it good trouble.
Let's not lose that. Okay.
That's a good trouble causer.
Exactly.
Good trouble.
Sometimes you do need to cause some good trouble. So I want to make sure that's not lost. It's not docility that we're saying should happen, but you need to know the moment. I mean, it's a big shift for what you're asking, transitioning from tokenism to power. And as Aggrey said earlier, I mean, civil society is valuable. We know the value. The kind of power shift I think we all want really does require some new norms. It means changing this top-down decision-making and how things are financed so that it's shaped again by lived experience and communities and civil society organizations who know what's needed on the ground in the local and, national, subnational context. I think that's quite a big shift. I think one of the things too, we didn't really talk about too much is this idea of data and information. I mean, Aggrey touched a little bit in it in his last response, but there's also a very top-down definition of what is what data is, what information is, how it needs to be collected, how it needs to be validated. And I think that's been a struggle for a long time for community organizations and civil society organizations in meeting this very top-down, highly quantitative data and information requirements to have their work recognized and to have the needs that they identify recognized as meeting the other needs recognized at the global level. And so there is that piece. And certainly as we enter into this very difficult time where disinformation is rampant, I think there has to be a shift as well of sort of how civil society talks about our work, documents our work, and make sure that the voice counts in meetings with donors. And it's not just about implementation. It's also really about, again, coming as solution makers, as partners to move these agendas forward. And I'll just say one last thing before I turn to Aggrey is when I say new norms, I mean, there's certainly the kind of operational process norms, but there is even this shift in the norm of when we say health is a right and not a charity, that is a shift in a norm. I also just want to say that often when we talk about global health, what we're really talking about is people being free of disease, which is not the same as people being healthy, right? Health requires not just like a service point entry where you can get your vaccinations and all those things and medicine. It's all important, but it's also about your environment. It's about clean air. It's about clean and sustainable water, safety from violence, safe working conditions. I mean, all of these things go into making a person healthy, a community healthy. And so already overstressed and low-resourced sector like civil society, that's a hard norm to shift, but it really does mean reaching out to maybe other organizations that aren't kind of traditional allies, right? And building that trust as a whole. It's a high bar and it's a lot of work, but the power shift requires a lot of new thinking and really changing a lot of these like staid norms that we all work within, the system that Aggrey referred to earlier.
Thank you, Elisha. Aggrey.
Thanks, Elisha. And I agree with all that you've said. So I think for me, the real shift when we have now real power being exercised by civil society definitely is from where Elisha started. It needs to be from ground up, from the lowest unit possible. And I want to use an example that I saw in my real life. And that's what I always wish that we could emulate. My father was a teacher and he was a trade unionist. I remember where he started getting his mandate from the school where he was. So you get your mandate from your peers in the staff room. They call you a shop steward, whatever they were called. Then you go to the next level, the locations, sub-location, until you go up to the national level. So when you reach the national level, every successive stage you have convinced and you have the mandate of the people who you are cumulatively selling your vision to and identifying with whatever vision that they have agreed on. And you represent that vision going forward. So when you reach the pinnacle of the representation, you are a vision bearer from the person, from the classroom where you started, up to all those different collectives or different classrooms, up to that national level or international level, if there's a space for that. So that's what I always wish for civil society organizations. The real power should be somebody who has the mandate, not me. It's sort of a making from what we had explained from the previous conversations. In a number of times, we are able to just start organizing at a national level because of the funding limitations. We work with people who are already engaged or involved. And Elisha mentioned something earlier that sometimes also, we are also very cautious that amongst ourselves, we can have gatekeepers. Because they know the higher you go, there are more probably opportunities and probably benefits that you can. And that's something that I think sometimes weaken our legitimacy. And my true desire is that we have a system that is supported in ways that help create authentic voices from ground up. And then when we go to these spaces, we are bearing the legitimate voices of the people we represent. And we have the support to go back and continue that accountability, that horizontal accountability with our peers, with our bosses, people who have elected us, if we're elected, and that I don't just appear somewhere and speak my mind and say that this is the voice of civil society organization. So for me, that would be a true shift in power. And if I don't get that mandate, I will say, oh, I'm sorry, I'm not able to appear in this meeting because I've not been able to get briefing from my bosses, who are the constituency members of civil society organization. That for me would be a true power shift. Our voices should not be things that are add-ons, peripheral, box kind of voices. It should be which each process, like for example, I give the example pandemic fund, pandemic agreement, for example, should have started at the national level, not just people appearing. I know they have supposed mandate, but socialized. In many contexts, we tried to engage in community, in conversations. People are hearing it for the first time, yet the conversation was at advanced stage. Yeah. So I would really love every critical process to really tap from ground up and get the voices of citizens. And I think that's an investment that should not be discretional. It should be mandatory. Thank you.
So should that be a civil society responsibility or the government responsibility?
It is government responsibility.
The ground up.
Yes, the ground up. So civil society, they are our own organizing, but I think we have to also understand the limitations that sometimes make things not happen that particular way. And therefore, this is a responsibility for everybody who is interested in supporting, including the donors and the philanthropies, so that we help this process to be anchored from ground up, because it needs to be anchored. It will be catalyzed in one way or the other. Yeah. And government must also implement it. Yes. Thank you.
Thank you very much, Aggrey. So now, very key points have come out from you and Elisha, and I'm hoping that we can all go to work with them to see that we can shift, transition from tokenism to true power, because civil society is indeed very valuable to not just global health, but development as a whole. The fun side of this is I have a number of quick fire round questions, and I'll go between you and Elisha. I'll start with one and then go to the other. You're not going to answer the same question, just so that we give everyone a level playing field. But it will be in quick succession. I'll start with Aggrey and then the next question to Elisha. Don't think too much about it. I'm just blending the world of global health with the little joys of everyday life. Okay. So you ready? If you're ready, and then I'll start. Yes. I'll start with the first. I'm sure you're wondering, how do you blend global health with the little joys of everyday life? But I'll show you. Okay, so Aggrey, you're up first. It's a this or that question.
Okay.
And you tell us the one that is you, right? Okay. Rural Health Mission or Urban Policy Summit?
Rural Health Mission.
Elisha, street food with the team or hotel buffet between sessions?
Street food.
Aggrey, sunrise field start or late night strategy call?
The first one?
Sunrise. Oh, okay. You're an early bird. That's good.
An early bird, yes.
Okay. Elisha, packed lunch in the field or airport snack on the go?
Oh God, packed lunch in the field. No airport food, please.
Okay. Aggrey, dancing at a local celebration or hiking after a long day of field work?
Dancing is my favorite.
Oh, I'd love to see you bust some moves. Elisha, solo work travel or group work travel?
I feel like as a boss, I have to pick group travel.
Because you have to show that you're a team player.
I'm a team player, everybody.
Nice. Aggrey, football match with the community youth or panel session at a health conference? Be careful on this one.
Panel for now. I'm past my football days.
Oh, okay. All right. Elisha, debrief over coffee or walk and talk with the team?
Walk and talk.
Okay. Aggrey, reading an article or binging on a global health podcast like this one?
Second?
Reading an article, a health article, or binging on a global health podcast?
Binging on a global health podcast.
Oh, thank you.
I love
and last but not least, that's good. Elisha, last but not least is beach recharge after a mission or city stroll during a summit break?
Beach recharge.
Very needed. Okay. Thank you, Aggrey and Elisha. It's been such a pleasure having this conversation with you today, but also such an honor bringing you and just discussing on how we can strengthen civil society voice as well as civil society presence in spaces of power, both at the national level, the regional level, and the global level. Thank you very much for being our guest today.
Thank you so much.
Thank you. It's been a pleasure.
Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going. This show was produced by Dennis Nazarov and AHF Global Communications and edited by Resonate Recordings. Want to learn more? Visit us at aidshealth.org or join the conversation on social media on X, AIDS Healthcare, on Facebook, AIDS Healthcare Foundation. Until next time, keep pushing boundaries, amplifying voices, and keep the revolution alive in 2025 and beyond.